Thank you, Mr. President. Mr. President, I come to the floor today, as I have week after week since the...
Senator, we're in a quorum call.
Thank you, Mr. President. I ask unanimous consent that the quorum call be vitiated.
Without objection.
I ask unanimous consent to speak as if in morning business.
Without objection.
Thank you, Mr. President. Mr. President, I come to the floor, as I have week after week since the health care bill was signed into law, with a doctor's second opinion about the health care law, because the President repeatedly made promises to the American people as the health care bill was being debated and even after the health care law was signed. And he promised to improve, not hurt, the quality of medical care in this country. We now know that the President's health care law actually makes the problems of health care in this country worse. In fact, since this bill was signed into law, we've learned that it makes the cost of health care worse. We know that it makes Americans' ability to get health care worse, and ability of individuals to keep the care that they like makes their ability to keep that care worse. So, Mr. President, today I'd like to first talk about the cost of care. And President Obama promised the American families that they would see their health insurance premiums go down because of the health care law. And he actually told that they would go down by over $2,000 per family. Well, now we know that that's just not the case. In fact, Americans have seen their premiums increase 19% since the time that the President signed his health care bill into law. And just looking at the front page of the Sheridan Press, Sheridan, Wyoming, yesterday, headline front page, health care premium increase. County administrative director said the county's cost to provide health care coverage for employees will increase by about $360,000 this year. We're talking about one county, 1 out of 23 counties in Wyoming, $360,000 for county employees. Throughout this entire health care debate, the President promised the American people that if they liked their health care plan, that his health care law would let them keep it. Another broken promise. Employers all across the country have made it clear that the health care law's mandates are too expensive and threaten their ability to offer insurance to their employees. A recent study by McKinsey & Company, which is a reputable national consulting firm, produced the report titled, "How U.S. Healthcare Reform Will Affect Employees' Benefits." They surveyed over 1,300 employers across diverse industries, geographies, and employer sizes. The results confirm what Republicans and American workers and their families knew all along, and they knew it long before the President and Washington Democrats forced this health care law down their throats. Overall, the report says 30% of employers will definitely or probably stop offering employer-sponsored coverage in the years after 2014, when the Obama health care law goes fully into effect. Among employers with a high awareness of the health care reform law and what's specifically in the law, well, then the proportion of those who will definitely or probably stop offering coverage jumps to 50%, and upward of 60% will pursue other options. Well, so at least 30% of employers would actually gain economically from dropping coverage, even if they completely compensated their employees for the change through other benefit offerings and higher salaries. Apparently, the President's promise of if you like the health insurance you have today, you can keep it, translates into you may very well lose your coverage. Now, as former Congressional Budget Office Director Doug Holtz-Eakin's analysis confirms, if employers decided to drop coverage, which is actually in their economic best interest to do in many cases based on their economic evaluation, the cost of federal insurance subsidies will skyrocket. Remember, the White House and Democrats in Congress met behind closed doors. They acted swiftly and covertly to pass a law without regard for how its provisions would impact each and every American family. Then the question is, will Americans actually have the ability to get medical care they need from a doctor they want at a price they can afford? The President promised that his law would increase access to affordable care. Some groups tell a different story. In April of 2010, a month after the President signed his health care plan into law, the Association of American Medical Colleges estimated that based on graduation and training rates, this country would have a shortage of 150,000 doctors over the next 15 years. In May of the same year, the American Medical Association issued the results of its survey showing the impact of low payment rates and the threat of future payment cuts on Medicare patients' access to care. The AMA found that 1 in 5 physicians currently restrict the number of Medicare patients they see. The AMA study showed that nearly 1/3 of primary care physicians restrict the number of Medicare patients that they take into their practice. And all any of the members of the Senate need to do is, at home on the weekend, talk to someone in your community, someone who's on Medicare, someone who's trying to find a doctor to care for them, and see how very difficult it is for someone on Medicare age to find a doctor to care for them. Well, later last year, the Association of American Medical Colleges related updated physician shortage estimates. The September 2010 study said that by 2015, doctor shortages are actually 50% worse than originally projected. By 2020, there'll be a shortage of 45,000 primary care physicians and a shortage of 46,000 surgeons and medical specialists. So I find it ironic that we have a health care law that's passed that actually doesn't put money into training doctors to treat you, but puts money in to hire IRS agents to investigate you. Absolutely astonishing. These studies clearly demonstrate that the President's health care law will only make it harder for Americans to see their doctors. In fact, Washington only expanded the ability of folks to get government-approved, government-mandated, government-subsidized coverage. They did not expand the ability of the American people to actually get medical care. And there is a huge difference between medical coverage and medical care. When you take over $500 billion away from our seniors on Medicare, not to save Medicare, but to start a brand new government program for someone else, well, that's a way to make the problem worse. When you force 16 million more people onto Medicaid, a program where half of the doctors in the country won't see those patients, that also makes the problem worse. And the front page of yesterday's USA Today, yesterday, Mr. President, Wednesday, July 6th, the headline, Medicaid payments go under the knife. State cuts could add to shortage of doctors. Second paragraph, some healthcare experts say the cuts, most of which went into effect July 1st, or will later this month, could add to a shortage of physicians and other providers participating in Medicaid. The article goes on to say that under the health care law, more than 16 million additional people will become eligible starting in 2014. So already we have a situation where doctors are reluctant to take care of people on Medicaid, and yet the President's solution to the health care dilemmas in this country are to put more people into a system that is already broken. Well, Mr. President, we're giving individuals and families an insurance card, but not really giving them access to the care that has been promised. And adults aren't the only ones who are in waiting lines to get into a doctor's office as the lines get longer. In fact, children enrolled in Medicaid have a much harder time accessing medical care than children who have private insurance. Yet that's the President's solution to the needs of this country. January 16th of this year, the New England Journal of Medicine published a study conducted in Cook County, Illinois. It's President Obama's hometown of Chicago. People were calling medical offices asking for appointments. They were asking for appointments for children with chronic conditions or acute conditions, and telling the offices, these were kind of secret shoppers, telling the office that the person had Medicaid or had private insurance. Well, what they found is that 66% of the time, when the researcher called for an appointment and they mentioned Medicaid, they were denied an appointment. But only 11% of the researchers calling for appointments who said they had private insurance, only 11% would not get an appointment. So there you have 66% denied if they have Medicaid, only 11% denied with private insurance. And those Medicaid patients who did get an appointment, well, they faced wait times twice as long as kids with private insurance, an average of about 6 weeks. Well, as one caller was told, when asked what kind of insurance the person had. When that person said Medicaid, the receptionist at the medical office said, Medicaid is not insurance. Yet that is what the President and the Democrats base their entire health care plan on. 16 million more onto Medicaid. So, Mr. President, here it is, over a year after the law has been signed, the President's health care law has made health care in America worse. Premiums are higher. The lines at the doctor's office are longer. It is more difficult to get a doctor to care for you. This isn't what the President's health care law was supposed to do, and it's not what the President promised the American people last year. He promised that the health care law would make health care in America better for all Americans. But each week we learn that the promises are coming up empty, and that health care in America under this health care law has been made worse. And that's why week after week I come to the Senate floor as we learn more things about the Senate, about the health care law that passed the Senate, passed the House, was signed by the President, and in my opinion, as a doctor who practiced medicine for 24 years, has actually been bad for patients, bad for providers, the nurses and doctors who take care of those patients, and bad for the taxpayers. Thank you, Mr. President. I yield the floor.